Hey guys, welcome to the Dr. Carter Vet podcast series. This is what we're gonna have called the Dog Doctor. Today we're gonna talk about one of the most common illnesses you can find in dogs in the tropics, heartworm disease. Have you heard of heartworm disease? Yes, heartworm disease is exactly what it sounds like. Worms in the heart. Heartworm disease is actually very preventable but can be fatal if not prevented. Now, some of the top clinical signs for heartworm disease is exercise intolerance, which means your dog is running about a bit, gets a bit tired for really easy things. Coughing. Sometimes it starts off where the dog is coughing in the morning, coughing in the evening, and then it coughs throughout the day. And of course, the one you never want to see is sudden death. Now, heartworm disease comes from the heartworm Deriflaria imitis. Deriflaria imitis. If you're looking at this on YouTube, it's going to be written there. If you're listening to the Dr. Carter Vet podcast, well, Deriflaria imitis is the dog heartworms or canine heartworm, or the worm that causes canine heartworm disease. Now, unlike most worms, which are like GI parasite, cause what you call a fecal oral or something transmission, or they would lay an egg. Heartworms do not lay egg; they're viviparous. Now, if you haven't heard of this word before, viviparous means it lays a live young. Now, an anaconda, for instance, or some of the boa family are viviparous snakes. They don't lay an egg; they lay a live young. So does the heartworm. So, heartworm lives in the heart, the right side of the heart. You can be diagnosed by. We'll get back to the viviparous in a while. It can be diagnosed primarily by doing a blood test. We do an ELISA assay, which looks for actually the female antigen. It's a fancy way to say the female would leave something in the blood, you look for it. So if you have, it's always adult female antigen. So if you have juvenile heartworms in the heart, it may not test positive. If you also have a bunch of male heartworms in the heart and no female whatsoever, it may also test negative. That is very unlikely to happen though. So yes, you can do a blood test. You can also do a capillary drop and look under the microscope and actually look for the microflaria, as you would call it, which is the juvenile heartworms. It would be dancing in a blood sample. It's beautiful to look under the microscope. I may put a photo here if you're looking on YouTube. If you're listening to the Dr. Carter Vet podcast, well, imagine it, yeah? A little worm dancing amongst the blood cells. Being viviparous, heartworm can actually come around and be self-infecting, but let me tell you how it's transmitted. It's transmitted by mosquitoes. So anywhere there is mosquito, you can actually catch heartworms, the dog. Anywhere there is mosquito, your dog can catch heartworms. Let me clarify something here. Now, some people believe that it's from drinking the water with the mosquito larvae. No, that's not how it is transmitted. Most of the GI parasites and internal worms might be transmitted from ingesting something. Heartworm, however, the mosquito would collect the microflaria when they suck the blood of a dog, of an infected dog. So if there is no infected dog in your neighborhood, your dog cannot catch heartworms. But the likelihood of that is rare, unless everybody's on heartworm preventative. Remember, heartworm is 100% avoidable if you use a heartworm preventative. So let me tell you how it's transmitted again. The mosquito would come along, bite your dog, drink some blood. The first stage larva would the mosquito mature a little bit. The mosquito goes off and drink blood from another dog, transmit that larva into the other dog. It's in the blood, travels to the heart, settles in there. Your dog is infected with heartworm disease. The good news is it is easily prevented. There's loads of different preventables. There's no really good stuff on the market where you do one injection every year, like your rabies vaccine or your vaccinations. There's stuff you do 2 injections a year. There's stuff you might inject every 3 months. There's tablets you can put every month. There's topical medication. Heartworm has been such a big thing in the dog industry, as you may say, for so long that there's so much different ways to prevent heartworm disease that if your dog has heartworm disease, it is definitely a situation with neglect. Here in the Caribbean, heartworm disease, normally if you don't use flea and heartworm prevention, you don't use flea and tick prevention as well. So here in the Caribbean, we have a situation where a lot of dogs come with what we call the triad: heartworm, olichia, and anaplasma. But today, we're going to be talking about heartworm. So the others will bring it up in a future talk, but just know that those things can happen together. And the test that we use is a snap test. I may have a picture up here if you're watching on YouTube. If you're listening to the podcast, it's a test where you put a few drops of blood in there and 8 to 10 minutes later, it comes up with if it's positive, it's going to show a marker wherever the positive sign is. If it's negative, it's not going to have a marker there. Test for heartworm, Ehrlichia, plasma Lyme disease. Actually test for 6 diseases. And it's really good because most times, most places you are in the world that has heartworms will have these other diseases. And if your dog has heartworms, he might have one of the other stuff. The other good news is the treatment is really similar for all of these diseases. So if you have one or the other, basically your treatment protocol could be almost the same. It might be very expensive though based on where you are in the world and the size of your dog. Now let's just think of a really big dark Rottweiler. Really big body mass, black coat. It's going to attract the mosquitoes here. Big old mastiff here. But small dogs as your little Chihuahua could also have heartworm disease. It's easier to treat in a small dog because the medication dose, but there is standard medication. There is the American Heartworm Association who has their drawn-out protocol. You can look at other places like TrueCap and Caribbean people who have. I have a protocol that's very effective. Also good on the pocket for my clients here. I've been doing this. I've only been a vet for almost 10 years, but I've been really involved in heartworm cases throughout that period of time, and I'm really good now at treating it. I was good from the beginning, but I mean, just saying, treatment is possible. Now, there is a few problems when you start treating heartworm is that the dog could actually die during the treatment phase. Sometimes the medication load, sometimes the dog, by the time you call the vet, sometimes people call the vet after the dog was coughing for months, after it fell over when it ran down the step behind someone. That time you already reached the end stage heartworm disease, which is almost impossible to reverse. But we can still try. But if you catch it on early, first of all, prevention is the first step to avoiding heartworm infection. Heartworm preventative. Use a prevention protocol that works for you and your budget. But if you're going to have a dog, make sure you're prepared to protect it against heartworm if you live in an area that has heartworm. Any tropical temperate regions will. If you don't want that, you go live in the snow. Go in the Arctic Circle where there's no heartworm, and you might be good up there. But with this global warming thing, you don't know how long that will last for. And what kind of life would you live anyway in the snow like that? Stay to the tropics, go to the beach, but put your dogs on heartworm preventative each. That was a quick rhyme there. Yep, so anyway, so this is the podcast. I don't want to stay too long on this, but heartworm prevention is the first choice. Now, if you did not manage to prevent it, or maybe you may not have heard of heartworm before your dog actually gets infected with heartworm and diagnosed with heartworms, the next step would be treatment. Most treatment protocol would last 30 to 60 days, most. Some may be more, some may be less, based on other factors, where you are, the veterinarian experience, the medications available. Treatment also would be dependent on what medication is available. The size of your dog is significant, because the dose in one thing, you might have to give 4 tablets, for instance, in this medication, while you might have to give 2 injections here, whereas if it's a smaller dog, it might be half the amount of injection there with 1 tablet. So treatment is based on the size of the dogs. The duration of the treatment would be based on the advancement of the disease generally. And then from there, the dog would have to be on preventative for the rest of its life. The damages that heartworm may cause to the heart, predominantly the right side of the heart, you can actually look on an x-ray and you would see that we call it a reverse D. Veterinarians would call it that. The heart would be distended to the right side. It looks like a D, a backwards D. So D is this way, it looks that way. And the damages, you also have this thing called Caval syndrome, where the vena cava is damaged a bit and dilated. But the damages may be irreversible. So you might cure the heartworms, but the dog may always be a bit off form, cannot run really fast anymore, cannot exercise for long periods, maybe coughing for months later, maybe years later if it survived that long. So the damages may be irreversible, but it can be treated. Early treatment is best at preventative medication. So if you're in the end stage, sometimes euthanasia may be the better option. Some owners would have to decide. I mean, at this stage, if it becomes to the quality of life of the animal is suffering a lot. Later heartworm disease, sometimes it gets to the kidneys. It has had kidney failure. You have a lot of secondary things that come on board. A lot of distended abdomen. You have what you call ascites, sometimes just frank blood in the abdomen. I've seen so many different things that it's impossible to list them out, but I've seen a lot of different things associated with long-term heartworm infections. But just know, keep heartworm away from your place by prevention. Keep all your dogs on heartworm preventative. Put your neighbor's dog on heartworm preventative too, if they'll allow you. Keep your mosquito burden low. Just do the basic stuff and you'll be okay. But if you missed a few months, some people miss a few months, we're living in a real world here. So hypothetically and ideally, you would want everyone to be on heartworm preventative throughout the year. But sometimes you can't afford it. Sometimes you missed a few months. Sometimes you forgot. That monthly alarm did not click. I once had a situation where someone had all the medication there for a full year. And they just forgot. 6 months in, then we realize something's off with the dog. We check it. Boom. Heartworm positive. The other thing you need to know is that heartworm takes about 6 months to be mature as an adult. So even though you get an infection as a microflaria, it's swimming through the bloodstream. Boom. Maybe take about 6 months before it tests positive. So within that period, you have choices. As well as if you have a puppy, most vets would tell you do not start heartworm preventative until 6 months. Or you don't need to start it before 6 months because, well, one, your dog would not test positive for heartworms before 6 months of age. But I prefer to start heartworm preventatives at 3 months because we're in a heartworm prone location. So it would be geographically specific. So based on where you are in the world, based on the heartworm incidence in your location, veterinarians may advise something different. But in general, 3 to 6 months is a good time to start your dog on heartworm preventative. And it's going to be something you'll have to do for the rest of its life, most likely. But yeah, it comes with the dog. Unless you're in an area that do not have heartworms. So you can check your local veterinary department to find out what are the common diseases in my area. And if heartworm disease is one of them, then you're going to have your dog on heartworm preventative. Is there life after heartworms? Yes. A lot of dogs come back from heartworm infection and live a really good, happy life, a peace life, running around, living, go to the beach, swimming. So there is a life after heartworm. So if you can treat, you should. And then you get it on preventative for the rest of time. What else can I think of to talk about heartworms? Oh yeah. So, common heartworm question. Another thing we have in the Caribbean with people, sometimes poison dogs. People would call you in and say, oh doc, someone poisoned my dog. It was good now. We ran down the street, he came back. He went in the neighbor yard and ate something. He came back home, it fell over and died. Sudden death is a symptom of heartworm. You go in there, you see no sign of poisoning and you see, boom, you look in the heart, it's covered with heartworms. Sudden death is a sign of heartworms. Coughing again. General weight loss. I've seen a lot of symptoms that's not out there in the literature. There's loads of literature about heartworm disease. You can find so much things out there. I don't want to be calling, wherever you're looking at this video, some medication may be available, some may not. Most of the ivermectin family of medication is really good. That's ivermectin, moxidectin, duramectin, a whole bunch of mectins used in the heartworm preventative. There's a lot of baseline, common, frontline, advantage, multi. All the things. Based on where you are, you would have those things. If you're in the third world or the tropics or somewhere you don't have those things, you can look for things like Bomac. A lot of livestock medication actually can be really good in heartworm prevention. But yes, talk to your local veterinarian, talk to your veterinary sport. If you don't have a veterinarian nearby, you don't have a Ministry of Agriculture or something, then hit me up in the comments. I can give you some advice on how to deal with the heartworm. If you're listening on YouTube podcast, then check back on the YouTube channel, look for the video, leave a comment below, and of course we're going to answer your questions about it. If you have any answers about any questions about heartworm disease, we can answer it. This is the YouTube podcast. You can hear the breeze in the background. I'm by a nice lake out here listening. I was here looking for birds. I did not see the birds I was looking for, so I decided, you know what, now is a good time to talk about heartworm, because every time is a good time to talk about heartworm. Hopefully we don't have to see your dog for heartworm disease. Prevent it if you could. Remember, heartworm prevention is best, but if you manage to catch it, call us and we'll do the rest. That's a good pitch. Anyway, thanks again for tuning into the Dr. Carter Vet podcast. I didn't want to be too long today with this one when we're talking about heartworm disease. We may revisit that in the past, in the future. Okay, this is unscripted, but we may revisit it in the future. We're going to also talk about other common infections that might be coupled with heartworm disease. That's just GI parasites. We're going to be talking about Ehrlichia anaplasma, which are tick-borne infection, Lyme disease, things that can affect people. And that's what I was going to tell you before I forgot. Things people ask me, can I get heartworms from my dog? So far, it has not been proven if humans can get canine heartworms. I know for sure cats can have it sometimes. Seals can have it. Seals and sea lions can have it sometimes based on where you're located. And even if a mosquito were to infect you with the larva of a canine heartworm, it would not be able to thrive in your body. So it may go wrong and probably land in your spleen or somewhere and get cleaned out of your system. So you might be able to get the larva in you, but you would not get clinical heartworm disease. Humans cannot. On this day, that's the case. In the future, it may change, but as of now, humans cannot catch canine heartworm disease. However, you should definitely try to prevent it because the mosquito does not discriminate between the dog and the person. So it can bite the dog. The same mosquito that bites your dog can bite you. And there has been cases with GI parasite larvae in humans, especially. Hookworms love to leave those cutaneous larva migrant marks on the legs. Sometimes you see it in the eye. Some really creepy stuff right there. So as it stands today, humans do not catch canine heartworms, but they may be exposed to it. But cats can catch it sometimes. There's also a feline heartworm, which is not as common as the canine heartworm. And sometimes other mammals, like marine mammals like sea lions and seals, could also catch canine heartworms. So yeah, hopefully you learned something today. Hopefully you like this podcast. Hopefully you like this series. Subscribe to the channel if you haven't. Listen again on YouTube podcast. I'm going to be doing a lot of stuff on the dog doctor. Talk about things that affect dogs. We're going to also have a podcast series named The Animal Doctor, which is going to have things that affect other animals. But I really wanted to focus on common diseases of dogs. So over the next few weeks, just check in for another episode. Today is canine heartworms. Tomorrow it will be something else. Thanks again.